I want to thank everyone on the NHS frontline. I'm sure the nation will join me in assuring you that what you do is appreciated, and every hour of your hard work brings us closer to a return to more normal times. You need to go away. You're bombing us. You're killing us.
Because of the COVID, we have to put on the mask. We have to do all that. She said, don't be a monkey. Take that off.
There were only 12 Black and ethnic minority nurses at senior levels within the NHS.
The NHS has looked after Britain's health for over 70 years, and its importance has never been felt more strongly as the nation continues to battle COVID-19. Since its inception, the NHS has relied on BAME and migrant workers in order to keep it running. But despite the heroic work they do, NHS workers are still not immune when it comes to suffering racism.
I think it was the war off Iraq at that time, and I was a healthcare assistant, and I was fasting during that period, and I wore a black scarf, not realising I was doing anything wrong. And this particular patient who I'd nursed for years goes to me, you need to go away. And I said, I beg your pardon. She said, you need to go away. You're bombing us and you're killing us, and now you're killing us in the hospitals. And I literally froze because I'd known this patient, and I said, it's me, Shaz. What do you mean?
A patient of mine who I see regularly, and every time, the last time I saw her, because I had to cover my nose because of the COVID, we have to put on the mask, we have to do all that. And she looked at me. She said, don't be a monkey. Take that off.
And she was like, no, what's that on your head? And that's when I realised that my headscarf was playing quite a big part in this.
One of my junior doctors in an evening shift was told by patients that didn't want to be seen by them. So this was a doctor of Pakistani background.
And I looked at her. And the first thing that came in my head is, she's as old as my father. So I went downstairs. I breathe in, breathe out, do what I have to do, went back upstairs, said, come on, let me give you your insulin. I'm not being a monkey. I'm protecting myself, and I'm also protecting you.
And I had to intervene and make it clear to the patient that, that the doctors are there to treat them regardless of where they're from or what they look like.
As soon as I approached her, she put her hand up like that to me and said, stay away. You're bombing us already. And I was like, whoa. And then I thought maybe she didn't realise it was myself. So I spoke and I said, so-and-so, it's me, Shaz. And she looked at me and she said, no, you're not coming nowhere near me. Get me a white nurse. Those were her words.
Without the migrant community, without that so-called Windrush generation, there simply wouldn't be a National Health Service. And that's the thing that people really need to remember.
Would the NHS survive without people coming into this country and filling those jobs? Will we have enough nurses? Will we have enough doctors? No.
So what advice would you give to doctors and nurses who are dealing with patients refusing to be seen by them because of their ethnicity?
NHS colleagues, clinical colleagues, are all guided by their duty of care. We in the NHS have got a duty of care towards our patients. My advice to them would be to explain to the patient that they are there to treat them. There isn't anybody else who's going to come and treat them. And it's their choice. If the patient makes the choice that they don't want to be treated by that clinician, then that clinician should walk away.
It's very difficult conversation to have because often patients aren't aware what they're doing is offensive.
But what must not happen, in my view, is then for a substitute who looks like them to then come in and treat them. Because if you do that, we are not tackling the racism. It should be meant, I'm here to treat you. If you can't accept me, it's your choice not to accept me. And I think if we were to go down the route of saying, well, somebody else that looks like them then comes in to treat them, then I think that sends the message to say that we are actually not fighting racism.
Last year, the Health Secretary, Matt Hancock, spoke out, ruling that demands for treatment from white clinicians should be refused.
If a patient refuses treatment for a reason that's completely unacceptable, like their racist attitudes, then the treatment won't be available on that basis.
It's not only overt racist abuse that NHS staff are faced with. Despite making up huge chunks of the NHS workforce, black and minority ethnic workers still face huge challenges when it comes to career progression.
You only need to look at the national staff surveys that all NHS organizations are mandated to do. And you will find in there a very telling story of how we still have a large proportion of NHS colleagues reporting that they can't progress into higher management roles. You still find a higher degree of white colleagues holding management positions.
To be honest, now I'm quite well established, but I'm fully aware that my scarf is a hindrance in a lot of things. I saw people progressing, and I was still sort of at that same level.
I started from the basics from the NHS. So when I left the NHS, went into the private sector, it was mainly because I felt the opportunity for promotion was not there. I was stagnant.
In society, you have a hierarchy of preference with white people being at the very top. And in the NHS, you have a similar picture. If you are from a white background, you're more likely to be in a leadership position. And if you're from a black and minority ethnic background, you're more likely to be in a subordinate position. And because the NHS is one of the biggest organizations in the world, it's the 5th biggest organization in the world. Obviously, with 1.4 million people, you are going to get the same kinds of experiences in the NHS that happen out with the NHS. What happened for me was I went for 5 senior level nursing positions for director of nursing posts, and I didn't get any of them. And I was always told on the day, well, actually, somebody else was better than you. Invariably, it was a white person that was better than me on the day, which is fair enough. So when I eventually managed to successfully get a job at the Department of Health, I was able to have what they call helicopter vision. So you can see what's going on across the whole of the NHS. And I was shocked and stunned at the time, and this was back in 2004, to see that there were only 12 black and ethnic minority nurses at senior levels within the NHS. So then you get a sense of, well, actually, this perhaps isn't me. This is perhaps how the system plays out.
Wow, that's actually really staggering, just 12.
There are only 10 now. Over the last 5 years, we've collected the data from all of the organisations in the NHS. And what we've done is compared the experiences of black and ethnic minority staff with white staff. And I'm delighted to say that all of the organisations in the NHS actually take part in this annual data collection process. And each year we put out a report stating exactly what the differences are between black and ethnic minority staff and white staff. And we're the only organisation in the country that's doing that.
A minute's silence will be held across the UK at 11 o'clock this morning to remember the key workers that have lost their lives to coronavirus.
Everyone on the front line working across the NHS and social care sector who have lost their lives.
What we're seeing now is the NHS and the frontline workers doing the most extraordinary job, and that's really come to the forefront in the last a few weeks.
And I think the current support for NHS colleagues, particularly those colleagues that are people of colour like myself, has been absolutely amazing, absolutely amazing. As I say, there are people that have absolutely given their lives. So my hope would be that life after COVID-19 will be fundamentally different. And I think it's going to make us move a way forward in the journey around racism. It will be a sad day, I think, if things went back to where we were pre-COVID-19.
Without immigrant labour at the moment, the NHS would not be surviving. We know that for an absolute fact. And maybe this crisis will bring those with racist tendencies to their senses.
I can't believe we're having this conversation. I can't believe this is actually happening during this coronavirus. It's terrible.
Hopefully, now that this has been brought to the attention of how fantastic the NHS are, then maybe this will help.
NHS workers should not be subject to racism and deserve a workplace free from prejudice.
The NHS is one of our most precious British institutions, and I'm sure everyone would like to join me in thanking all the NHS workers and staff in the heroic efforts that they've put in during this crisis. Let's all join together to show racism the red card and show support to our key workers.